Greetings, everyone. Today we will discuss the longest-standing public health legislation in American history, the Maternal and Child Health Block Grant. The MCH Block Grant was established in 1935, and since then, Arizona has seen a substantial decrease in infant mortality rates. Along with this public health success, the MCH Block Grant has contributed to numerous successes in Arizona and throughout all the country. Here's what some of our very own public health professionals have to say about the MCH Block Grant.
My name is Jane Pearson, and I am Associate Director for St. Luke's Health Initiatives. St. Luke's Health Initiatives is a public charity that is involved in health policy research, public education, technical assistance, and community investment. But prior to that, I was Assistant Director at Arizona Department of Health Services, where I was responsible for, among other things, the Maternal Child Health Block Grant.
My name is Billy Lynn Brown, and I've been in public health since the early 60s, actually. I was lucky enough to attend a nursing school that did have a public health program, so I was trained in public health. And I went into full-time public health work with the LA County Health Department, and prior to that the LA City Health Department in downtown Los Angeles. And I worked there for about 3 or 4 years, and then I transferred to another program with Kaiser Permanente. After that, I have done public health in Pinal County in Arizona and in Yavapai County in Arizona. And I was in Yavapai County for about 18 and a half years, and a total of maybe 8 or 10 years here in Pinal County.
Why was the MCH Block Grant important to the health of our community in Arizona?
The Maternal Child Health Block Grant is basically non-categorical funding. It allows the state and counties to be able to address critical maternal child health issues specific to this Arizona and specific to individual counties. It's highly flexible, and so it's designed to be able to be responsive to specific both local and statewide needs.
That grant provided funding for care to women and children. The reason it was important was because in many of the counties, especially rural counties, there weren't always the funds to hire personnel to deliver maternal and child care. So the nurses that were hired and funded by this money were able to go out and do well baby clinics in areas where we had no clinic sites, and we would use facilities such as church basements or that type of thing. But it gave you the personnel to provide that kind of care.
I believe the single most important and effective thing that we've done under the block grant is high-risk perinatal care. And there has been state money in this as well, but a lot of it has been federal and continues to be federal, meaning block grant. And if you look statistically, in 1950, Arizona had an infant mortality rate of 53 per thousand live births. And in 2009, most recent that we have, it's 5.9. It's the lowest it's ever been in Arizona. And a good deal of that can be attributed to block grant.
Can you share an example of a public health issue you, as part of the MCH Block Grant, have addressed?
So for many years, the state contracted with county health departments to provide well baby care, if you will. And that care was quite variable, both in terms of the array of services, but the depth of services. And as access came into being in our state, those children actually were much better served by being a part of the access system. So we began the transition of saying to county health departments, the state would no longer pay for well baby clinics. We said to county health departments is, your job as a county health department, as a public health agency, is to assure that every child in your county has access to and receives primary care. This was a big challenge. I mean, at first it was a major transition from providing individual patient care to thinking about all children in their county and addressing and making sure all children in their county receive primary care. Not that they would be giving it necessarily, but they would have access to. And so each county came up with unique ways they wanted to do that. But out of many counties and many local efforts came the notion and the endorsement of school-based health centers.
There were not necessarily always personnel to cover the very rural communities in Arizona. And by being able to have the funds for those personnel, you were able to broaden the amount of care that you provided. And I think that was something that the funders of Title V should have been very proud of also, as well as those of us who were able to develop programs and implement them.
What were the challenges you faced, and how did you overcome them?
I believe in all of my experience, the main challenge is always funding. Prevention isn't always something that is able to be shown. I can recall attempting to start programs, and one of the first questions would always be, how can you prove to the Board of Supervisors that having this type of program is going to save them money in the long run? And sometimes that's difficult. You have to go by what the statistical evidence is. But because, and I sympathize with the supervisors, they're under the scrutiny of the taxpayer, so they have to be careful what programs they decide to help cover or decide a county health department to have.
There's a concern about obesity in children as being a major problem. They'd like to do more on that front in terms of mainly I think in terms of education.
What do you hope to see happen in the next 75 years?
I think the next 75 years, we're going to be challenged in thinking about how to influence those life course events. How do we address chronic conditions and interfere with the transmission from generation to generation? Secondly, how do we maximize the opportunities that technology offers and to impact the health of our moms and babies in the state?
Generally in public health, I would like to see worldwide awareness that prevention really does help, that it works, and as part of prevention, you have to have your educational component. You have to teach people why it's important for them to immunize children or to get prenatal care or will prevent them from having catastrophic illness. And that's not always easy, but that is one of the greatest missions of public health. And I would like to see a stronger world commitment to that type of programs, and also a willingness to pay for them, which isn't always there. And to understand, for the funding sources, to understand that that is a very important part of their responsibility in the use of tax dollars.
What advice would you give to someone who is just entering the field of maternal and child health in public health?
Maternal child health is one of the few places in public health that sort of bridges the whole continuum of public health practice. MCH practitioners have the opportunity to engage in all areas of public health to influence the health outcomes of moms and babies. First of all, it's intellectually stimulating. It's, in fact, if you look historically and even now, maternal child health is always on the cutting edge. As an example, with healthcare reform, everybody's talking about medical home. In maternal child health, we've been talking about medical home for 20 years and doing medical home for 20 years.
Generally, it has always been very rewarding for me. It's not the kind of work where you necessarily go home at night feeling that you got the job completely done, but you don't usually go home feeling badly about what you've done in the days. It is a very fulfilling kind of work, but I think anyone who goes into it needs to understand that frequently you're going to have a fight on your hands for obtaining the monies necessary to provide needed programs. And you're also going to somehow have, or sometimes have, resistance from the people that you're wanting to provide service to. At one point, I had a feeling that I had told everyone in the world about the need for immunizations, and that somehow they just still didn't get it. But that's not true. It's that fundamental information isn't always taught in school or other places where parents would get information. So you're going to be satisfied, but it's not always going to be easy.
In the last 75 years, the MCH Block Grant has made a significant difference in the life of mothers and children across the country. The next 75 years is now in our hands. May we continue the legacy of the MCH Block Grant and further expand the capabilities of assisting others.